Hey guys, Greg here, Bone Tactical. I'm going to share with you what I believe will be the most complete review on the internet of medical kits, combat medical kits specifically, or tactical medical kits. A customer of mine goes by the name Doc and has some combat medical experience, and we've been discussing getting this video out for a long time. Totally in agreement that the most important thing when looking at purchasing a medical kit, other than the quality of the kit itself, which I'll get into, the huge vast array of differences. Not all med kits are created equal. In fact, they're almost all crazy different. You have ones that are garbage and ones that are great. But the most important thing is the March principle. And so we'll discuss the March principle as well. Very quickly, the March principle is MARCH. M is for massive bleeding, A is for airway, R is for respiration, C is for circulation, H is for head trauma and hypothermia. So you want to be able to treat at least those 5 things. Then you can look at PAWS from there, which is PAWS, pain, antibiotics, wounds, and splintering. And that's kind of the stuff that you want to be able to get into as far as the abilities that your kit can give you. Obviously, M, massive bleeding, is the most important, and that's why you get some guys who will just carry a tourniquet. I think most guys that carry a tourniquet everywhere they go are probably guys that are tactical guys most of the time, because, you know, I can do a pretty great tourniquet with some 550 cord and a pen, but a good tourniquet is good to have, right? This is kind of the standard go-to tourniquet here. As you can see, this one I got from Tacticon Armament. So we'll start with Tacticon Armament. They're not the best, okay? So I'm not gonna start by saying I'm gonna show the best. The best pre-packed medical kit I've ever seen is this My Medic kit, so we'll get into that. And then what I like to do is pack my own medical kit with my particular needs, and that's kind of what I recommend. This is a cool Tacticon Armament version that's tactical because it's, you know, army green. Okay, so this is the holder for the tourniquet right here. Little tourniquet holder, Molly tourniquet holder that has your, you know, the name of your stuff on there, and everything says tourniquet right on it. So your tourniquet goes inside of here. Here's the actual tourniquet from Tacticon Armament. Tactical tourniquet holder. So this is a tourniquet, this is the little pen. Since we're going in the order, as I'm reviewing these different things, I'm going to show you all the different levels of the different med kits. I'll link all of these in the description below, okay, where you can get them from. Starting with Tacticon Armament, I think it's about the cheapest, but you're definitely going to want to stay tuned, because I'm going to discuss with you as well what these different kits can offer, all right, and why they're priced different and what that means to you. So definitely stay tuned. You're going to want to learn about all this stuff. But if you want to have the absolute minimum for the March algorithm, you want to be able to stop massive bleeding. A tourniquet doesn't necessarily stop massive bleeding. A tourniquet can be applied to a limb. You want to apply a tourniquet high and tight, and that just basically means high and tight, right? So if it's either the brachial artery or the femoral artery, those are your arteries. The arterial bleeding is why you would want to apply a tourniquet, but you know, the March principle, massive bleeding is kind of the most important thing. It has a lot more to do than just a tourniquet. So I really just don't understand fully why somebody would carry just a tourniquet. It just doesn't make sense to me. It's never made sense to me. Almost everybody that I've seen that carries only a tourniquet is just a tactical person. I mean, if you carry a gun and a tourniquet and a extra mags, it's like you should carry a med kit, man, if you want to be successful. Or, you know, don't just carry a tourniquet to be cool. And I see so many guys, just like a fad thing, carrying a tourniquet. I'll never understand that, but understand the principles of, you know, controlling massive bleeding. If you've got holes in you, you want to pack those holes. You want to be able to use combat gauze on, you know, externally. Quick clot, you know, some type of quick clotting agent. Pack the holes, and then externally you'd want to use, you know, the quick clot with, or they have bandages now that have quick clot on them, but big holes, pack the holes with gauze, wrap everything tight, compression bandages, stop that bleeding, get that bleeding controlled. If there is arterial bleeding, slap a tourniquet on there, slap it on high and tight. So that's the kind of stuff. First off, you want to have gauze in your first aid kit. You want to definitely check for that. You want to have some kind of a compression bandage. You want to have quick clot. So that'll get you through your really, really generally speaking massive bleeding, which is the M in the March algorithm. And I know this stuff simply because where I'm operating and when I go out, let's say, or I'm doing something, nobody's coming to save me. So I have to be responsible for my own health, the health of my employees. We'll get into every shop that I have in every different country, every HQ that I have, every location that I operate out of or in. I have first aid kits set up there, absolutely necessary. Even in the US, where it's just a warehouse where we sell stuff from, all of my employees have cut themselves unsheathing knives because the people that do the shipping are generally speaking not like combat experts or martial arts experts. A lot of times it's been females that don't have a lot of edged weapon experience. And generally speaking, I've found females to be more careful than males when it comes to cutting themselves. But a lot of times they'll pull a knife out and have their hand over where the blade will come out when it comes out and cut themselves really bad, or they'll either, if it's a man, what they'll usually do is they'll try to resheath the knife real fast and not be looking good enough at the knife lining up to go in the sheath, and instead of going in the sheath, it'll miss the sheath by a little bit and they'll stab right into their hand. And my knives being so sharp, it's actually often really, really bad. So we've had to bring pretty much all of my employees that have worked in my shop have cut themselves really badly, in my warehouse there, and we've had to take them to the hospital and do first aid treatment on the way, right? Stopping the bleeding, that's what it is. None of them have had to have a tourniquet because none of it was arterial bleeding, but some of them have had really bad cuts, and you've got to know how to treat those cuts. In that case, it would be some kind of a quick clot and pressure bandage, right? So those are the things to look for. I'm gonna continue moving right along. This is the Tacticon armament as well. This stuff will, like I say, it'll all be linked in the description below. IFAK is kind of like your military term for your med kit. So the military guys are gonna be calling their med kits an IFAK. I've got an IFAK here from Mountain Man Medical, which will compare that IFAK to the IFAK from North American Rescue here. I believe this is from LA Police Gear, this North American Rescue pack. So I believe that's where you can get that from, is LA Police Gear, but it is a North American Rescue. So we will compare three of the top leading brands in the tactical space compared to My Medic, which again, My Medic just blows the doors off these other guys, and we'll get into why in a minute. But Mountain Man Medical, North American Rescue, and Tacticon Armament. And we'll compare these three IFAKs. Your IFAK is going to be kind of like your minimum field medical kit for a tactical or combat professional, combat situation or a tactical professional type deal, right? In this one, we've got pretty standard bandages. There's a pen in here for marking, maybe, certain things, or for writing. If you're actually a medic, then you have like triage cards, or I forget what they call them, but there's, if you're actually a combat medic, you have like a little card that you fill out that you strap to your patient. And it's worth mentioning, okay guys, the March algorithm, and when we're talking about combat medical, you don't apply combat medical in an actual like shootouts or combat situation, right? Your security of your team and everything, and everyone comes first, or yourself. You have to, you're not shooting at the same time. You have to at least get that person to a safe place or lock down the situation to where you're tactically sound to be able to give medical help. You have to figure out the tactics first. You got to take out the enemy or move to a safe position, 360-degree protection, and at that point you can begin to apply care. Okay, so just getting that out there is super important. But going through what we have, we got some safety pins in here. Again, once you start looking at the person that you're going to be using this on, then that's when you begin March. You're looking for massive bleeding first. Then you're looking for A, which is airways. So you're checking their airway. What could that require? Your finger. Okay, you might want to listen. But there's also NF nasopharyngeal, basically a tube. Okay, so there's a little tube that a lot of times it comes with lubrication, and you lube up the tube and you shove it in their nose, and then up to like a lot of them have like a little thing on there that sits right there, and then that's one way you can keep their nose open. You may have to do an emergency tracheotomy if the windpipe is crushed. Airway is you have to make sure that they have an open airway and the ability to breathe after you check with the bleeding. I will say, the order of the march is very important, and you guys should probably understand, and really I hope you comment below and challenge me on this, but I don't even find many doctors or medical professionals that understand this. I understand this more in my role as a martial artist, let's say, or a tactical professional. Life is lost by blood loss, and massive bleeding being the number one. I always tell people, it's funny, especially medical professionals or hunters, or hey, if we're talking about taking out an enemy, even there's really only one way to take out an enemy or to kill an animal or whatever, if you're hunting, whatever you're doing, and that's blood loss, stoppage or loss of the blood. And everybody says, well, no, that's not true. What if what about a headshot that's massive brain trauma? Well, it's because the brain's not getting blood. Oh, well, that's not true. What about a heart to the shot? A shot to the heart? That's a kill shot, right? Well, it's because the blood is no longer circulating, because the heart is the body's pump for pumping blood. Oh, well, what about the lungs? It's the blood is no longer able to be oxygenated, so it's the same. You're just not getting oxygenated blood to the body. So when you talk about massive bleeding, the most sure death is not having oxygenated blood being pumped throughout your body. That's kind of the most important, and that's why we always look at massive bleeding first. So we'll go through, combat shears, which is basically scissors. There's tweezers. So your shears are going to be once you start getting later on to the phases of like R in March, C in March, which is you're checking for circulation. In order for me to actually check the box, which is like respiratory, I want to look for holes. If there's holes in their lungs or if there's holes in their chest cavities. If you get shot and you got a hole in your lung, you might have a sucking chest wound. We'll deal with that in a minute when we get to R. But I've got to cut the clothes off of somebody, to be able to check for things, especially once I get to circulation, which is C. And so I'm, in order to be able to check for stuff like that, or in order to be able to pack a wound in M, which is massive bleeding, in order to be able to pack a wound and put a compression bandage on there, I need to probably clean it first, depending, or I at least need to get the clothing cut off and out of the way and see what I'm looking at, be able to evaluate and make sure that I'm doing the right thing. So of course, training is incredibly important with all of this stuff. We need to understand a light is super good to have, because if in a real combat situation, you don't know whether you're going to be around even electricity. Here's that tube I was talking about. Hopefully, if it's a good kit, there is lubricating jelly in there. So this is the tube that gets stuck up the nose. So in part A, March, airways, you're going to want to pretty much stick that tube up their nose so that you know for sure that they're breathing through there. Check that there's breath coming through. Here's compressed gauze, it's compressed is cool just because it fits smaller into the pack. There's a space blanket in here, which we get into in the H, I believe, which is hypothermia. You want to make sure there's gauze, all good stuff. This splint variation is really not absolutely necessary. I think that this takes up too much space. If I'm going to be carrying this, I would pull this out so I could take it in have a smaller bag. I don't need a splint variation. That's not going to save somebody's life. That's just going to keep somebody from getting hurt. And pain pills are smaller than a splint variation anyway. This looks like an Israeli bandage, which is down in here, which I find interesting because I used to carry Israeli bandages. There were times when I would only carry an Israeli bandage. Way back in the day, because either it's all I could afford or I just didn't have, I had to be very small. Yeah, this is basically what I call an Israeli bandage. They're calling it a trauma wound dressing, right? But this is way more important to have than a tourniquet, in my opinion, because I can make a tourniquet out of just about anything, and not every injury is going to be an injury that I'm going to want to use a tourniquet. I'm much more likely to use a combat dress or a Israeli bandage is what I'm going to call it. Combat, whatever they call it here, same thing. But that's the difference between somebody having a little bit of experience and then somebody wanting to take cool pictures for their Instagram of their tourniquet with their EDC loadout. They've got some snaps in here, light sticks that are either for signaling to where the helicopter's going to come pick you up. Probably not going to be something necessary for you for that. But another thing is if it is very dark and I have no other way to see what I'm doing, there's another tourniquet in here. So, this is a pretty standard IFAK, guys. I'm not going to be signaling anybody. This huge splint thing I would say is unnecessary. But I don't consider this to be a bad med kit. There's been situations where I've been really heavy, what you would maybe call undercover, what I would call clandestine, being really heavily behind enemy lines, so to speak, working by myself, where you can't have a military IFAK with you because you're going to imagine going through a security checkpoint and your cover is that you're a fisherman or that you're there, as a missionary or something like that, and you have military gear, military med kit, all this kind of stuff. It's like, what the heck how are you going to explain that? You got to think about all this kind of stuff. You don't want to be traveling. Like if you guys travel, yeah, bring some medical gear, but you're probably not going to want a kit that looks like this. I would much rather have a kit that looks like this than a kit that looks like this. Plus, if I have to tell somebody go get the red bag, that's a lot easier to do than if I tell them to go get my stupid Molly bag that makes me look cool on Instagram. But anyway, I'm gonna say that Tacticon armament doesn't necessarily make a bad IFAK. It's pretty big and bulky, and it's not something that I would want to bring just about anywhere with me. This is Mountain Man Medical. Just opening it up, the fact that it's a lot more applicable to the real Gray Man theory. Check out the real Gray Man theory so you can understand it's not what you think it is. But this is much more applicable. I can be carrying this and it's not going to cause unwanted attention like the other one would. This one in particular is a lot more compact and well laid out. It's a lot easier to open. You saw me fiddling with the other one it really just didn't seem like a great system to me. I've got my gloves right here on top, so if I'm actually treating somebody, the first thing I'm gonna do in a real situation is put my gloves on, especially if I don't know the person. Why? Because I don't wanna get my dirty hands contaminating their wounds, but also I don't wanna get whatever diseases they have if I don't know them. Trauma bandage, okay, which is basically some sort of a type of what I was discussing earlier, being like an Israeli bandage. We've got the tourniquet in here. We have compressed gauze. We've got like an ace bandage, self-closing ace bandage here, which those are nice. The self-closing ones are really nice, just because you don't have to put those stupid little ace bandage clips on there. That's just probably, I'm gonna use this probably as over the top of the gauze once I pack a wound compression or quick clot, and then use this. I haven't seen any quick clot in here yet. Let me check. Usually they're back here. Chest seal. So, okay, this is a good time to discuss the chest seal because this is something very important. Talking about March, where were we at in the March algorithm? MAR, airway. So airway is making sure that your airway is cleared. We talked about the thing you stick in the nose. I don't see the nasopharyngeal tube. I don't see that in here. So that's one thing that I would want. If it might be in here and I'm just not seeing it. I don't see it. So the M, we've got, our gauze, tourniquet, quick clot. Then the A, we've got our nasopharyngeal tube, basically the ability to do emergency tracheotomy if necessary. You could pretty much do that with your pocket knife and a ballpoint pen, but whatever. So the same tube from the nasopharyngeal tube, technically you could use. I usually like something a little harder though to do the emergency tracheotomy. From there we get into R, which is respiration. If I have, so now we're looking, I got my gloves on, I'm using my combat shears, I'm cutting the person's clothes off, and I'm looking all around their chest and back. As long as they don't have a neck injury or if they're broken pelvis, then I don't want to move them, right? But if they don't have a neck injury or a broken pelvis, I'll roll them over, check their back, check all their chest. If they've got an entry hole, if it's a sucking chest wound, it's gonna be either blowing or sucking. Air's gonna be coming in or coming out, blood oozing. I'm thinking of the word in Spanish comes to mind, spuma, which is like frothing. It's gonna be like bubbles of blood bubbles coming out. I don't know if you guys have ever seen that or not, but that's what a sucking chest wound looks like. And usually if you have one in the front, you've got one in the back. If the bullet went in, it probably went out. So at that point, you got your gloves on, you're cutting the clothes off, you're looking at those wounds, and you're sealing. So that's when you just clean it off the best you can, if you can, depending on how nasty and dirty it is. If it's just blood coming out, then you're gonna try and cover it for this few seconds. You can, if you can, get a buddy to help you open this. If you can't, tell your friend to cover it. If you can't do that, just open this. It's basically a sticker, and you just put the sticker on there. Get one on their front, get one on their back. You may, at that point, have to use a decompression needle, which there's 2 points. There's one, which is like in this general area. It'd be the second rib after that. So you have collarbone, rib 1, rib 2. You find rib 2. You go up in the void that's above rib 2, inside line of the nipple, and you shove a needle in there, decompression needle. You'll see if they're not getting oxygen in their blood, then there's something going on. I do see the chest seal twin pack, and you definitely always want a chest seal twin pack. And what's very funny is this is a North American Rescue twin pack inside of this med kit, and then this is the North American Rescue med kit. So what we're basically doing here is going in levels up of med kits, of the IFAKs, better quality and better quality. This is the Mountain Man Medical. All right, I'll link this one in the description below as well. I like it a little bit better for the stated reasons of not looking so crazy tactical, and as well having just a little bit smaller, easier to carry, a little bit more well organized, although it didn't have as much stuff as the Tacticon Armament. So I would put them right around on the same level. North American Rescue is a reputable company in the industry. They've got a bright orange tourniquet here, which is cool. They've got your quick clot gauze, which this is absolutely essential. That's what I was telling you. One of the first things you look for your bleeding is that. They've got a little mini roll of duct tape, which I love that they have that. Duct tape is so great to have. And then the fact that they've rolled it around a little tiny thing and have it stowed away, just great. That's something that used to be an old inside trick that now they're putting in all of their bags. Amazing. Really nice pair of shears in here. The difference between a nice pair of shears and a crappy one can save somebody's life in the time that it takes to get their clothes cut off, especially depending on what they're wearing, right? I've got, looks like a bag here for stuff, blood contaminated stuff, or maybe needles or whatever, a little red bag there. Instruction manual for use, the gloves right here on top like they should be. Like I say, the first thing you're gonna do is glove up if you're treating somebody that you don't know, or if your hands are dirty, and your hands are pretty much always dirty. So unless you're gonna do, surgery prep before you treat them, then just put the dang gloves on. This is a NAR emergency trauma dressing, so it's like their version of, like I say, the Israeli bandage. I'm only saying that because that's what I knew, that's what I carried, and that's what worked for me. And then here's your basic kit of burn gel, alcohol, prep pads, just different things. The better the med kit, the more kinds of you'll start to get into antibiotics and painkillers and stuff like that. This might have some really low-level painkillers like aspirin or ibuprofen, but when you want to start you want some serious painkillers if you're really talking trauma and you're going to be doing a lot of the treatment yourself. I'm going to want to be able to give morphine, Dilaudid, stuff like that. And then, of course, at that point, if you're working on a combat team, when you're assessing these type injuries, one of the things that you also have to consider at the point that you're giving treatment to a person who's either in shock or that you're giving them drugs, then you got to take their weapon away from them, and communication devices and stuff like that, so they don't make any tactical errors that could hurt your PERSEC or OPSEC in this case. But just something to consider. If you do upgrade your med kit, I always upgrade my medical kits to carry to have different prescription grade, medical stuff. If I'm in a country that allows it or something like that, especially, I'll have painkillers or anything like that, because, like I say, nobody's coming to save me. I have to be able to do this stuff myself, and I know that. So here is the holy grail of IFAKs. This is not even an IFAK, but if this is what I keep this in my truck. I just pulled this out of my truck to bring it over here. I keep this other bag over here in my truck. But this is the best you can get if you want to buy a med kit that's pre-made. This is it. This is awesome. It's MyMedic. This is from MyMedic. This is I forget which this one's called, but this is the kit from MyMedic. You can find it on their website. And it's amazing for a few reasons. One of the reasons is that it's awesome sealed box, doesn't get dirt and dust in there, keeps the stuff fresh. Another reason is the quality of the stuff. If I'm going to be doing a wound closure, this kit has wound closure options. The other ones don't even have any wound closure options. And the organization of this is just absolutely amazing. Amazing the fact that they have everything comes in one of these little bags where it says how to use it, what it is on the outside of these little bags. They're color coded so you can find it quickly. I mean, this will literally save somebody's life. So they've got everything. They've got quick clot dressings, which we talked about, one of the top most important things. One-way valve barrier for giving CPR, emergency pressure bandage, all really high quality Band-Aids, and then some other stuff super skin. You don't see a lot, like you get an entire clean and prep mod pack. You just pull this out. It's all topical stuff for cleaning and prepping wounds. They've just got and everything. Look at all these different colored pouches with just so cool. This is just so cool. This is the medication with your ibuprofen in there. This is burn mod, so when somebody gets burned, you just pull this out. It even helps you. There's even like little cards in there that help you know how to use it or remember how to use it. So here's look how cool this is. It even shows you a diagram on the front. This is the NPA, nasopharyngeal airway, and even shows the picture on the front of how to do it. I mean, and that's in the March principle. That's the second thing you do. If they're not bleeding all over the place, then you tube them. You just stick this tube up their nose so you know that they're able to breathe, right? Because a lot of times these people that you're giving this medical attention to, they may not be able to tell you what's going on with them. You may not know, and you have to go through that March algorithm, and you have to start treating stuff as you can treat it. And in the A phase, you're just sticking a tube up their nose so you know at least that they're able to breathe through that tube. You don't know what else is going on. Triangular bandages, and this is tools and devices. Which is Z-Zips, which is kind of like a butterfly bandage, but a newer version of a butterfly bandage. And you got another tools and devices. Thermometer comes with like a high quality thermometer, big, nice tweezers. Sprain and fracture. It's got a water purifier along with electrolyte packs, which is, when you start getting to the end of the March principle, if they're in shock or something or have head injuries, some of the only things because H is head injury or hypothermia, and some of the only things that you can do for a head injury, guys, are like prop the person up at a 30-degree angle and maybe give them an IV. Well, none of these IFAKs have IV capabilities. So this one's really cool because it has a water purifier. It might be dirty water and electrolyte pack. At least you can try and get them some electrolytes somehow. If they're not drinking and they're not conscious, obviously it's not going to be that easy. But all stuff to consider, and then always go with your level of training, guys, and get the training. So just remember that these kits are only as good as you knowing how to use them. But I'm showing you what the differences in the med kits are. And so that MyMedic helps so much because the stuff is like more self-explanatory. It helps somebody who might be out of touch with their medical skills or more of a layman to be able to use that. So that's one of the reasons I'd recommend the MyMedic. This is a bag I put together myself. The bag itself is from LA Police Gear. I'll link the LA Police Gear in the description below. This is this is what I call the Israeli bandage. I guess this is one I've carried for a long time. It's probably out of date. But this is the Oleus modular bandage. This is the same thing that I used to carry way back in the day. Got a kit in here that I have just in case I need to give an IV. Athletic tape, which I love. Athletic tape has so many uses. A mirror. Why do you have a mirror? Well, because nobody's coming to save me. And if I have to do medical work, there's a good chance that if I need medical work, I'm gonna be doing it on myself. So I have a mirror for that. This is another medical kit from Adventure Medical Kits. In here, so this kit you can purchase right from Adventure Medical Kits. And I hit you with a little switch up there because again, we're going over all medical kits. I really like Adventure Medical Kits. They're not as good anywhere. They're not anywhere near MyMedic, but they are good. And I like this kit because it's, generally speaking, it's relatively affordable. Quick Clot, so that's, you always want to see Quick Clot. We've got a tourniquet in here, a SWAT tourniquet. We've got triangular bandages. I think most of them have some sort of a triangular bandage, almost all of them. This one has the duct tape, it has splints. It has actually a medical manual, which is cool. So you can, study up when you're wanting to. Splint as well, so this allows you to start getting into, fracture, sprain, field trauma, has a field trauma kit, and then your medication, wound care, burns, and blisters. So me being a Christian, I trust that God is gonna take my life or allow me to go to heaven and leave this world when it's my time to die. And I don't think that I'm gonna die prematurely, so I do like to be prepared. I think that we are the masters of our own destiny, and I have the opportunity to learn and to learn about medical stuff and learn how to care for myself, so I should take advantage of that. But I don't need to spend all of my money and be a crazy person spending so much money on medical stuff that I'm not being a good steward of my money. So I don't have all of the most high-tech stuff. A lot of the stuff that I have is stuff that was sponsored gear. Luckily, I've been able to get that. And so if I didn't have any of that stuff, and when I am buying the stuff every time, this is kind of like what you would actually see from me more of, and me reutilizing stuff and then just buying the stuff that people really need. And this is how I take care of my guys here, my apprentices at my workshop where I'm at right now. I have a big thing of alcohol. I always, every time somebody gets hurt, I clean, the first thing I do is glove up and clean the wound, okay? So clean and treat. I do sell med kits on my, first aid kits on my website. So the ones that I sell are these. They're the ones that I use as well. Very comparable to this other first aid kit here. I think I was selling these for a while first. Now I'm selling these. These are a little better. And this is the current version, which this is actually what we use here too. So every time I pop this bad boy open, all the ibuprofen's gone because everybody's always needing something for either a sore back or, a headache or whatever. So, they have ibuprofen. I think most of my guys have taken all those, a lot of the Band-Aids and stuff, but we go through here, alcohol prep pads, stuff's really useful. Instant cold pack, if you got whacked with something, if something fell on your head, whatever, instant cold pack, all that stuff's really useful. Those are the ones that come in my emergency. I make emergency survival kits, bug out bags, whatever you want to call it. They come 100% ready to go, and those are the med kits those are the ones I most often use. I have these other ones that you've seen behind me, and I got those in to show you guys. Mostly I'm going to start using this stuff now, and then some of them I have just around for, in case of an emergency. There's a surgical suture kit here, light, and the gloves are just stuffed in there. As soon as you open it up, you grab the gloves, put the gloves on, and then the thing that I'm most probably going to need is either going to be the tourniquet or that, but probably most often it's going to be that Israeli bandage or a modular bandage system and or quick clot. Those things are the most important. The tourniquet as well. All of this stuff will be linked in the description below. I'm going to put discount codes down there, and then you click those links and you'll get there'll be discount codes either next to the link. It'll say use code Bone Tactical for 10% off, so use that code, or it might even be an automatic discount with that link. I hope you enjoyed this video. Research March algorithm and pulse as an add-on for the medication and further treatment options. Learn that stuff, learn what to do in these situations, practice, and get yourself some gear if you can. Thanks for watching. Bone out.